do some hand hygiene. Hi, my name is Judith, and I'm going to be your student nurse today. Can I please check your armpit? Can you please state your name and date of birth?
Brianna Rose, 12/9/97.
Perfect. This is the correct patient. So today I'm going to perform an oxygenation assessment on you. It should take about 10 minutes. As I go along, I'm going to explain everything, so please feel free to stop me if you feel comfortable, if you have any questions.
Okay.
Patient understands the purpose of this exam. Okay, so can you please empty your bladder and put this gown on with the ties in the back? All right. Are you comfortable with this room in respect to warmth and privacy?
Yes.
All right. Patient is prepared for the exam and is comfortable with respect in the surroundings with warmth to privacy. So before we begin, I just have a few questions to ask you. Do you have any troubles with your lungs, any breathing or cardiac respiratory issues?
No, I do not.
All right. Do you have any trouble coughing?
No,
Okay. Have you or ever smoked?
I have not.
Okay. And do you have any shortness of breath or any pain?
No.
If the patient had any symptoms or problems, I would assess using old cart size and use the special circumstances procedures. So I'm just going to go ahead and I'm just going to observe your breathing really quickly. Okay. Appearance is upright, breathing is effortless and quiet, patient is relaxed, musculature is well developed, skin tone is appropriate for race, there's no lesion noted, and then I'm just going to go ahead and check your pulse for a few seconds. Right. Respiratory rate is 14. I'm just going to go ahead and place this probe on your finger to get your oxygenation. Okay. Oxygenation levels are 98%. And then I'm just going to go ahead and inspect your nails and your lips. So nails are pink, nail beds are 160 degrees, the lips and oral mucosa are pink. And then I'm just going to go ahead and go around. And then I'm just going to inspect your breathing from the back. So the ribs are sloped down at 45 degrees. The thorax and scapula are symmetrical, and the spine is straight, and muscle development is equal. So I'm just going to go ahead and I'm going to listen to your back and your sides. If you could just take a deep breath every time I move my stethoscope. All right, perfect. Posterior and lateral lung sounds sound clear, equal. Bilaterally, there were no presence of any crackles, wheezes, or adventitious breath sounds. So then I'm just going to go ahead and assess your breathing from the front. Okay, so thorax is symmetrical, muscle development is equal, and the costal angle is 90 degrees, and the AP to lateral diameter is 1:2 ratio. So I'm just going to go ahead and listen to your breath sounds from the front as well. Alright, lung sounds sound clear and equal bilaterally, and there are no notes of any wheezes, any adventitious breath sounds, or crackles, or anything like that. So I'm just going to go behind again, and then I'm just going to palpate you in 3 areas. Let me know if you feel any pain or tenderness. Any pain or tenderness?
No pain.
Alright. There was no pain or tenderness located between the scapula, the thorax, and within the vertebrae. There's also no pain or tenderness noted with the ribs. They do seem stable and equal bilaterally. So then I'm going to go ahead and every time I move my hands, if you could just say 1, 2, 3 for me, please.
1, 2, 3. 1, 2, 3. 1, 2, 3.
Perfect. Vibrations are equal bilaterally, and they're palpated bilaterally. So then I'm just going to go ahead and do the same thing from the front. So I'm just gonna go ahead and touch, palpate a few areas like your throat, your chest, your costal, your collarbone, and your ribs. Okay. Trachea is midline and symmetrical. Collarbones are symmetrical, muscle development is equal. And ribs are stable, equal, bilaterally. So then I'm just gonna go ahead and do the 1, 2, 3 again as I go.
1, 2, 3. 1, 2, 3. 1, 2, 3.
Vibrations were palpated bilaterally, and that was the end of the exam.